Hi, my name is Stacia. I'm going to be your nurse today. Is it okay if I perform a little assessment on you?
Absolutely.
Okay, perfect. While I'm putting on these gloves, can you tell me your name and date of birth?
Lonnie Winters, August 8th, 1963.
I'm going to check your wristband. Lonnie Winters, August 8th, 1963.
Yes.
Perfect. Okay, can you tell me where you are right now?
The hospital?
Yes. And can you tell me what today's date is?
September 20th, 2023.
Yes. And can you tell me who the president is?
Biden.
Okay, perfect. I'm going to do a little assessment with your eyes, so just look at my finger. Pupils are equal, round, and reactive to light, 3 millimeters bilaterally. Face is symmetrical. Do you use any assistive devices for it to hear?
No.
Okay, what about any dentures or anything like that in your mouth?
No.
Okay, can you open up your mouth so I can just look at it real quick? Okay. Nose is patent, no assistive devices, hearing's appropriate. I'm gonna take a listen to your heart first.
Okay.
Aortic, pulmonic, herbs, tricuspid, and mitral. Okay, heart sounds sound good. S1, S2 noted. No murmurs. I'm gonna listen to your respirations. When I touch you, just if you could breathe in.
Okay.
If we were doing a sub-Q injection, where would we do it? Like the fatty parts of our.
And then do you have any issues with sitting up? So I can listen to your back?
Or the box. Perfect. And what injection are we typically getting there?
Like insulin.
Perfect. Okay. What is special when we are giving a patient insulin in the hospital? What is like some precautions we have to do? So if I tell you go give Mr. Smith 10 units of regular, what precautions would you take with that?
Is it insulin and heparin?
No, so more like I'm looking for like 2-person identifiers.
Okay. You can lean back now. Lung sounds are clear and all lobes bilaterally. I'm going to do the rest of your vitals. Blood pressure is 126/80. Respirations are 20. Oxygen saturation is 98 on room air. Temperature is 37 degrees Celsius. And heart rate is 88. Skin is intact, appropriate for raise, warm and dry to the touch. Do you have any allergies?
Yes, to penicillin.
Okay. Next, I'm going to have you squeeze my fingers.
Okay.
And then I'm going to have you push down on my hands with your feet. And then push up.
Is there any left?
I'm going to feel your pulses now.
That's for, what one is that one for?
Pulses are palpable and 2+ bilateral. I'm going to feel for your pedal pulses. Pedal pulses are 2+ bilaterally.
Oh.
Next, I'm going to have you just flex and extend your arms. Okay, I'm going to have you do the same with your legs. Okay, perfect. I'm going to check your capillary refill. Capillary refill is brisk in less than 3 seconds. I'm going to do the same on your toes.
Okay, if we were to be giving a patient.
Capillary refill is brisk in less than 3 seconds bilaterally.
Right here.
Are you in any pain right now?
I have some like pain right here in my stomach. It's kind of like a sharp pain.
Okay, like in the right side?
Mhm.
Okay. So I'm going to look at your stomach first.
Okay.
Stomach is flat, no abnormalities noted. And then next I'm going to listen to it and then I'm going to pop it.
Once, but one time. Do you want to practice putting a needle on a syringe? Let me see. You can grab, one of these, and we can put a needle on it. If we have needles over here, I'm going to restock this, is what's going on.
sounds heard in all 4 quadrants.
Let's put a needle on.
Okay, I'm gonna palpate.
There's some pain there.
Right
Yeah,
there?
that's where.
Anywhere else? Okay. Alright, so just right here?
Yes,
In the upper
yeah.
quadrant? Okay. Pain noted in the right upper quadrant. And you said, what would you rate that pain on a scale from 1 to 10?
It's like an 8.
Okay. What does it feel like? Is it sharp, dull?
It's like a sharp, almost kind of like a stabbing pain.
Okay. Alright. Skin is intact. There are no wounds. Patient has an IV in the left antecubital, 20 gauge, placed today for surgery later. Are you going to the bathroom okay?
Yes.
Okay. Can you tell me what your urine looks like? Describe it to me.
Just clear yellow.
Okay. Any burning or pain?
No.
Okay, perfect. Can you tell me when your last bowel movement was?
Yesterday.
Hi, this is Nurse Dacia calling about Miss Winters in room 1. She's a 60-year-old female with gallbladder disease who has a laparoscopic cholecystectomy scheduled for 1300 today. Patient has an allergy to penicillin and has been NPO for surgery. She also has a 20-gauge IV in the left antecubital placed today. Patient has a 6-month history of intermittent right upper quadrant abdominal pain. Patient had a recent hospitalization for acute cholecystitis 2 days ago. Cholecystasis was identified with an abdominal ultrasound. Patient is widowed with 1 grown son, lives alone, and does not take any home medications. Patient is alert and oriented ×4, has clear speech, appropriate hearing, and pupils are equal, round, and reactive to light. Patient is able to follow commands with no nausea, vomiting, and has normal voiding. Patient's vitals: BP is 126/80, heart rate is 88, respirations are 20, and temperature is 98.6 degrees Fahrenheit. Bowel sounds are heard in all 4 quadrants. Patient reported pain and tenderness in right upper quadrant, which they rated an 8 out of 10 and described it as sharp. Patient is self-ambulatory with no assistive devices and has full range of motion in all extremities. Patient's last bowel movement was yesterday, September 19th. Patient has normal sinus rhythm and clear lung sounds bilaterally in all fields. I recommend confirming that patient consent has been signed, explaining to the patient the process of a laparoscopic cholecystectomy and what the patient should expect to experience post-surgery, such as abdominal distension and discomfort, as well as interventions that the patient can perform for pain, such as laying on their left side with their right leg flexed, and to recommend the patient ambulate as soon as possible. I also recommend ensuring the physician puts in an order for pain medication.